Our last two diseases are diseases of the bowels. This is inflammation, specifically in small and large intestine. We'll start off with Crohn's disease, and then we'll look at ulcerative colitis. A lot of the issues with these diseases are pretty similar. The manifestations can be slightly different, though. In both of these diseases, too, they're also chronic diseases. This is chronic inflammation that's happening over large amounts of time. With Crohn's disease, we don't really know why it happens. There's some sort of inflammation that starts, and it doesn't start throughout the digestive tract. It starts in what they call little skip lesions, little locations in the small and large intestine that will become inflamed and will chronically stay inflamed. Now, through the inflammatory process, whatever is causing this inflammation is going to start remodeling the tissue as the inflammation does, trying to heal the underlying connective tissue that's there. So you see deposits of fibers. You see granulomas forming, those walled-off little granulomas. As the tissue is consistently and constantly being remodeled too, you can form little penetrations through the different layers of the intestines. You can also form fistulas, or actual connections between sections of the small intestine. These little fistulas like here. Now, inflammation, again, is associated with loss of function. And the more that you have inflammation in a specific area, you get more fibers building up as you continuously remodel, trying to heal the tissue. And that can also lead to loss of function as well. Crohn's disease has these weird little abscesses, perforations, connections, lots of scar tissue, connective tissue, granulomas. All of this prevents the normal functioning of the small intestine in that area. That leads to malabsorption. You're not absorbing everything you can in that area. It also leads to sometimes blockages. So these fibrotic little connections can connect to outside, or they can connect to each other and seal off that portion of the small intestine. That would be life-threatening. That would need to be corrected pretty quickly. With Crohn's disease, the manifestations of this are pretty general. You're going to have abdominal pain. It's going to feel bad. Diarrhea is going to be a result not only of just the inflammation, but also just malabsorption. If you're not absorbing all of the sugars and lipids, that can stimulate increased motility, and that leads to diarrheas in some cases. Depending on the layers that are compromised, if it's perforated through all of the layers, you can end up getting blood being released into the small intestine. Occult blood is blood that's undetectable with naked eye, but we have diagnostic tests that can detect that. General sort of fever because of the inflammation. Because you're not being able to absorb all of the nutrients you need to, you'll probably see some weight loss. And because you're not getting enough energy, you're probably going to feel tired all the time. A lot of it's pretty general. Abdominal pain, diarrhea, malnutrition stuff. Crohn's disease is diagnosed through imaging, usually. They'll do a physical examination, look for those same symptoms on our list, but we're usually going to have to diagnose it with some sort of imaging, whether that's through a camera on a tube, through an endoscopy or a colonoscopy, whether that's through radiography, taking x-rays or a CT scan through the areas. Those areas of fibrotic deposits can be visualized with an x-ray. Fistulas can be visualized, and taking stool samples, looking for blood, looking for bacterial presence that can help us identify that this is Crohn's disease. How do you treat something like Crohn's disease? You try and prevent flare-ups. So again, the cause of Crohn's disease isn't super well known. Like, we don't really know for most people why these little areas of inflammation kind of start up. So if we can identify some things like maybe it's a spicy food that you tend to see a flare-up afterward, you're going to reduce that spicy food. Try and reduce irritants to prevent that inflammation from starting. You can use pharmacological treatments to try and reduce the inflammation in general, and if needed, go in and correct stuff with surgery. So if there are blockages, those need to be removed, maybe reducing some of the lesion areas. Just trying to manage the symptoms, though, preventing future flare-ups. That'll reduce the amount of damage that's being taken. Now, while Crohn's disease is mainly found in the small intestine, ulcerative colitis is mainly found in the large intestine. Now, the large intestine doesn't do a ton of digesting. It's mainly just for water reabsorption. A couple of vitamins get reabsorbed, a couple of ions. By the time the chyme has reached the large intestine, we're not doing much digestion. Similar to Crohn's disease, we don't really know what causes ulcerative colitis. Some data suggest that maybe it's partly autoimmune disease because they found some antibodies for the epithelial cells in the digestive tract in the colon in people's blood. So maybe it's partly that. But what we do know about ulcerative colitis is that the progression is fairly standard. It usually starts at the anus, and then the inflammation progresses across the sigmoid colon and up the descending colon, usually staying pretty superficial. Now, as this inflammation is taking place, it's damaging the tissues, and it's also making it pretty easy for this thin layer of epithelial cells to be sloughed off and to cause bleeding from the underlying mucosa. By the time the chyme has reached the large intestine, a lot of the water has been removed, and the stool, as it's becoming, is pretty condensed, so it can be kind of abrasive and can easily damage this inflamed tissue. When it does damage this inflamed tissue, it's going to produce little ulcers, little removal of the epithelial tissue, and exposing the underlying tissue too. With these ulcerations, then you're going to have the replacement of that tissue as healing takes place through the inflammatory process. But again, because you're sloughing off cells that need to be replaced pretty often, there's an increased risk of colorectal cancer because of this the constant replacement of these cells. A lot of the same manifestations in ulcerative colitis that we saw in Crohn's disease, things like diarrhea, abdominal pain, fever, weakness, anemia, for a lot of the same reasons. A more common manifestation that we see in ulcerative colitis and not in Crohn's disease is rectal bleeding. Because of the increased ulcerations and because it's so distal in the large intestine, clear usually down to here, there isn't a lot of time for digestion of that blood to take place, and so stool tends to have blood in them, depending on the severity of these ulcerations. How do you determine if someone has it? We're going to do, again, a physical examination. Look for those same symptoms. Get an endoscope, look at a camera, look for those ulcerations. Maybe use x-rays, CT scan, and then check for anemia. If someone's consistently bleeding from their rectum, they're going to have low levels of red blood cells. Very similar to Crohn's disease, with ulcerative colitis, we're again just kind of treating the symptoms as they come up. We're going to try and monitor diet to make sure that the person is properly hydrated. This will cause the stool to be a little looser too, to hopefully not be as abrasive. Making sure the person is eating a well-balanced diet, trying to remove a lot of the irritant foods and things if needed. Maybe putting them on immunosuppressant drugs, anti-inflammatory drugs. For some patients that might work. Some patients, though, might require surgery. So lots of similarities between Crohn's disease and ulcerative colitis, a couple of differences, so be aware of those differences.